How long does it typically take to recover from the flu? Have you ever wondered how long it takes to bounce back from the flu? Recovery from influenza, commonly called the flu, usually takes about 1 to 2 weeks for most healthy individuals. The flu is an acute respiratory illness caused by influenza viruses. Symptoms often include fever, cough, sore throat, muscle aches, and fatigue. In some cases, complications like chest infections can occur. The initial phase of the flu typically lasts around 3 to 7 days. This is when symptoms are at their worst. Most people start to feel better within a week. However, some symptoms like fatigue and cough can linger for several days or even a couple of weeks after the main illness has passed. Mild cases often resolve on their own, but it's important to rest, stay hydrated, and take care of symptoms to support recovery. For individuals who develop complications, recovery can take longer. For example, mild acute bronchitis, which can follow the flu, may take 1 to 3 weeks to resolve. Viral pneumonia can require 2 to 4 weeks for recovery. If bacterial pneumonia occurs as a secondary infection after the flu, it can take 1 to 3 weeks for symptoms to improve with antibiotic treatment. Full recovery might take even longer, especially in severe cases, which may require 6 weeks or more. Recovery time can vary based on several factors. These include age, overall health, and whether any chronic conditions are present. Older adults, young children, pregnant women, and those with weakened immune systems may experience more severe symptoms and longer recovery times. Sometimes, post-viral symptoms like prolonged fatigue, muscle aches, and joint pain can persist for weeks or months after the initial flu infection. This is not typical flu recovery, but highlights that some individuals may experience extended recovery or post-viral syndromes. In summary, a healthy person typically recovers from the flu in about 1 to 2 weeks, with most symptoms resolving in that time frame. Complications can extend recovery to several weeks or more, underscoring the need for proper medical care and rest during illness. If symptoms worsen or do not improve after about a week, especially if breathing difficulties, high fever, or chest pain develop, it is important to seek medical attention. Vaccination remains the best preventive measure against influenza and its complications.